Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Life Course project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.
There's nothing bad, but we just want to make sure we're not missing anything, okay?
One of the issues healthcare providers face in improving outcomes for patients is the challenge of bridging the gap between provider and patient. For many of the chronically ill, confronting a highly technical and fragmented system can feel like trying to navigate in a foreign country, a place where you don't speak the language and don't know the local customs. Indeed, many in the healthcare community frame our current system in these kinds of cultural terms.
If you think of culture as learned beliefs, we definitely have a medical culture. We believe in Koch's postulates and the germ theory and biomedical models of disease. So when we talk to patients, we say, well, it looks like you have a viral infection, you don't need antibiotics. And so we have our own medical culture and our own medical language, and patients may be coming from a very different perspective.
So do we know what his blood pressure was back?
Sometimes we're not aware that we are culture, but we live it out constantly.
It's a very different set of understandings and beliefs, so we have to cross that chasm in our discussions with patients every day.
Well, hello.
Yep. How do we recognize how they're listening to us and what they hear when we say dog? They may, they're listening and they hear D-O-G, but it means nothing to them.
Could be something.
Part of our culture is the assumption that everybody is going to follow the rules of health outside of the hospital. Some people will, some people won't. Most of the time it's because people don't have access or they're not educated into being able to do it.
What about other symptoms? Do you have any?
If negotiating our healthcare system can be difficult under even the best of circumstances, imagine the hurdles if you don't speak the language, come from a minority culture, or are educationally disadvantaged. All of the individuals you're about to meet have had to overcome cultural barriers in seeking healthcare solutions.
Yeah, the first time I learned about
their stories shed light on the challenges many older Americans and their families face as they cross the border from health to chronic illness. On most afternoons, you'll find Linda Stone walking for exercise around her apartment building. Born and raised in Grenada, Mississippi, Linda has lived here in Minneapolis since 1972.
I moved here in 1972, right out of high school. I was married 20 years. My husband's name was Anthony. I got 2 kids, Anthony Jr. and Tara is my daughter. And my husband passed away 3 years after our 20-year anniversary.
Widowed with 2 children, Linda worked as a personal care attendant, or PCA, taking care of the sick and elderly in their homes. In the late 90s, Linda returned to Mississippi to take care of her parents, both sick with cancer.
My mother got sick with colon cancer, so I left everything and went to take care of her. She passed, and then my daddy had a brain tumor, so I was staying there taking care of them and not taking care of myself. Ended up putting on a whole bunch of weight and stuff. When they passed away, then I was getting sick. I noticed I was getting sick. And so my kids called me, they lived up here, they wanted me to come back. I drove, I think 13 hours sick. When I got to my daughter's house, I was feeling real dizzy. I asked her to take me to HCMC. My blood pressure was really, really high. My sugar was 1164. They couldn't believe it. They said, "You walked in here?" I said, "Yes, I walked in." He said, "You're not in a coma?" I said, "No, I'm talking to you. So I'm not in a coma." And he started calling me a blessed lady.
Linda was suffering from high blood pressure, congestive heart failure, and type 2 diabetes, among other ailments.
Thyroid problems too, they discovered that. My kidneys was failing, my heart was failing. And so I was just in and out of the hospital probably for the next year or so trying to get straight myself.
In trying to regain her health, Linda was battling both serious symptoms and an inflexible medical culture which offered a one-size-fits-all approach. She soon found herself at odds with her cardiologist.
The heart doctor came in because they wanted to give me a defibrillator. And I said, no, I don't want that. And so he told me if I didn't have it, I was going to die. So I had to take my chance with God.
When a person ends up being categorized as uncooperative, non-compliant, and they won't help themselves, and those are the kind of language. We've told them what they need to do, and they refuse to do it. There's always a story behind that. The underlying story informs that behavior. And sometimes we give up on them because we think they don't want to be better, but they're crippled by the other things that are surrounding them in the hospital.
In Linda's case, she found herself overwhelmed by opinions from multiple specialists, all speaking in hard-to-understand medical jargon.
They would just tell you, like you've been to college and using these big words I didn't understand. And I would ask them, could you explain that to me? They would explain it in some more big words. Good morning, how you doing this morning? And so I just told my daughter, I gotta find out a doctor, not some doctors.
Hi, Miss Stone.
Hi, how are you doing, Dr. Lewis?
How you doing?
Things began to turn around for Linda after she started seeing Dr. Fred Lewis, a family practitioner here at the Open Cities Health Center in St. Paul.
And he said, I'm gonna do everything I can to get you well. I'm gonna get you on the right medications. No other doctor had told me that before.
My first words was, I heard you were good and I've been all over town and I'm not happy. How's the blood sugars been?
Blood sugars have been fine. Yeah, I'm
really You have plenty of your insulin?
Huh?
You have plenty of your insulin?
Nope, I need that.
All right.
Get that one. You know, he wasn't talking at me, he was talking to me, so that helps. Yeah, because some of them have gotten mad and stuff like that. You know, I'm thinking I'm trying to do my best.
Can you remove that jacket?
Oh, yes.
When I first started practice, I didn't really have time to take the time to listen. I actually thought I was in control, but it got better when you start listening to what the patients say. Okay, I want you to take a deep breath for me. In an exam, there's two parts. There's the science of the disease, there's the art of what you do. And the art is, in my opinion, is just as important as the science.
So if a thing is explained well, then you would do better. If your doctor encouraged you like he's doing, you would do better.
You can't manage a patient without participation. 50% of what we do has to be the patient's ability and the willingness to comply with what you agreed to do. Bowels move good?
Huh?
Bowels move good?
No, that's right. I have been having problems with that.
And so that's a part of patient education. Patient education is important, and now it should not be, I think, passed on to some nurse or some other assistants in your office. I think the physician has to explain these things.
So that really helped. He sent me to some good people to help me with my diabetes and with my congestive heart failure. Start walking when I got where I could walk. Put a little bit of salt, not much. It's the only thing I put on it is salt. So I start changing my eating habits. I hated spinach, I hated a lot of vegetables, I hated broccoli. And now I love all that stuff because it's helping me. Because I feel like if it wasn't for Dr. Lewis, I would have been gone. So because he cared, so I started caring about myself. And that was the turnaround for me.
If you go to a program, whoever is running this program you have to make this program as much as fun as possible, also learning as much as possible.
April Smith runs the Health and Wellness program here at the Minneapolis American Indian Center. The program offers exercise classes, a support group, and nutrition and cooking classes for Native Americans 45 and older.
This program is asking basically our elders to look at their health when they don't want to.
Countless studies have shown that Native Americans are at greater risk for a whole host of health problems.
More American Indians die from complications of diabetes, heart disease, and stroke than any other culture that is out there. And I believe it's almost 10 times more likely that American Indian will have diabetes versus the Caucasian population. They were never taught how to be healthy. They were never taught to look at nutritional labels. They were never taught to pay attention to sodium levels.
That was when they were taking all the children and putting them in boarding school.
Some of the elders gathered in April's office to talk about their lives, their health issues, and their experiences in getting medical treatment.
At one time, they did not go home for 3 years because their parents couldn't afford to bring them home.
The Native American elders in this generation, some of them were subjected to boarding school era. Within the boarding school era, they were taught violently to not question authority.
This legacy of mistreatment can have a major impact on how Native Americans perceive and relate to the medical establishment. It's something April saw in her own mother.
My mom did go to boarding school. Growing up, I noticed she never questioned authority. Even though she was a very strong woman, she passed away about 3.5 years ago from a rare form of liver cancer. And I knew when she started having problems, started getting sick, I knew I needed to go to the doctors with her because she wouldn't, first of all, ask them questions. She wouldn't ask about the medicine because they were doctors, and in her opinion, they knew what they were doing.
I think you have to speak up to let them know what you want instead of just assuming, you know.
For some of the elders, speaking up is not a problem. It's more a matter of being heard. Many comment on difficulties in communicating with their doctor. There's either too much or not enough information.
Listening to your doctor or getting more information from your doctor really helps a lot if they tell you what's going on. Because my doctor did not educate me on what to expect.
Yeah, the first time I learned about diabetes, I went to the doctor, and what she did was she gave me some pills and said, "Here, take these." And I said, "Well, what are they for?" And she said, "Just take them." I thought, well, you know, I've lived this long, and my doctor comes back in a week. I should be able to live another week, you know, not taking them.
And she didn't tell you you were diabetic?
No. She just did this examination and said, "Here, you got to take these." And eventually I ended up going to Indian Health Board, and I had Dr. Rock. And he listened to me. I mean, I said, before you say anything, before you diagnose me, I said, let me tell you what's going on. And they suggested I go to their class, Basics of Diabetes. I learned everything about that I, you know, could possibly learn in 10 weeks about diabetes.
We really emphasize, for example, with physicians, medical students and physicians, don't use medical language. That medical language you use in your culture with your colleagues, but if a patient doesn't understand that medical terminology, then what you're trying to do, which is help the patient, you know, make a plan together with the patient about their diabetes, for example, all of that work that you're trying to do sort of goes down the drain if you're not able to cross that medical culture, that medical language.
You can still learn. You might pick up on something that you were told before, but now it's sticking, you know.
Pero si yo ya sabía que todo esto pasaría, como diablos fui a caer.
Sí, un ratito más.
Ramona and Angelo Figueroa are among the first to arrive and last to leave the drop-in senior center here at Clues on St. Paul's West Side.
Clues is a nonprofit organization that has been around over 30 years here in the Twin Cities area. It's the largest Latino organization serving the Latino community. Aging Well Services is the program that provides services to the aging population, the Latino aging population in the Twin Cities area. Our program is all done in Spanish. They play their games Mexican lottery or dominoes, all in Spanish. Everything is done that way.
Program Director Adriana Shelton says these elders face serious health challenges, some of which are culturally determined.
The expectation for Alzheimer's cases in the Latino community is expected to grow by 600% by the year 2050. Some of the biggest culprits of the disease are obesity, high blood pressure, cardiovascular disease, high cholesterol levels, and those are big things within the Latino community. In their home country, they're used to cooking a certain way. And now it has become a challenge to educate them on how to eat still around their culture, do their cultural dishes, but in a healthy manner.
I don't speak English, but when I need to speak English, I speak English. But sometimes, not always.
One of the biggest challenges that we see here is the language barrier. I would say 99% of our senior participants are Spanish-speaking primarily.
Yo he sufrido mucho, mucho, pero aquí estoy, en el nombre de Dios.
I have suffered a lot, but I'm here in God's name.
Ramona and Angelo Figueroa speak the Spanish of their native Puerto Rico. The couple moved here in 1980 to be closer to family. Ramona has battled cancer in various forms since 1977.
She's had, I believe, stomach cancer, breast cancer, and currently is battling spinal cancer in the last stages of that. Even though she's sick, she's dying from her illness, she's always having a positive attitude, very upbeat spirit, making sure she's always laughing and participating. She loves coming to Aging Well Services. She loves to be part of this program.
Pero ya tengo 6 meses de vida y me dieron de 1 mes a 2.
But I've been living for 6 months now, and they already gave me 1 or 2 months.
Ayer cumplí 6 meses.
Yesterday, it was 6 months ago that I've been alive. And now, sick or not, I'm here, happy and willing to continue living.
Yo siento aquí en mi corazón que voy a vivir más tiempo, porque Dios está conmigo. Me entregué a Dios y tengo muchas de eso que contar. Tengo mucho, ¿cómo se llama?
I have historias, anécdotas, yeah. I have believe always that the only real doctors is God and myself, because the doctors I have had have already told me that I had 1 to 2 months to live, and I'm still here.
Ramona's upbeat attitude is a product of a deeply held belief system. But this kind of traditionally held belief isn't always acknowledged or understood by the medical establishment.
We have a set of understandings, I think, growing up in the United States and having these conversations, knowing that the medical care delivery system is really sophisticated. There's a lot that can be done at the end of life, and as you get closer to the end of life, you're going to be needing to have conversations and talk about it. In many communities, that just is not the case. You don't talk about it because it's up to your God or up to the length of your life is predetermined, or perhaps it's bad karma from wrongdoing in a previous life that makes your life end. So these biomedical constructs about what happens with death and dying are very different across other cultures.
Ramona, though, takes death and life kind of the same way. You know, she's very happy, and she's made many comments about how she's happy to know that she's dying and that she's going to die soon, because she will see her relatives or her children who have passed on already.
I love you.
I didn't go to school today.
No, ma'am.
Marie Garner is 90 years old. She lived in Birmingham, Alabama until 2013. She now lives with her son Carlton and his family in St. Paul.
My mother's always been the pride and joy of my life. She was a special education teacher.
This is your favorite chair. There we go.
She's always been very charismatic, very involved in her church community.
She's the type of person that would light up a room when she would go places, and will lead there with people knowing who she is and what she's all about.
Yes,
But do you know who I am today?
Yes.
Who am I?
You are my son.
You're absolutely right. I'm your baby son.
I have
2 boys. They are high school age. Where's Christina?
She's coming. She's on the way. She's preparing the food.
Huh?
She's preparing the food. You know, Christine is a cook.
Yeah, but where is she now?
She's coming.
She's taken a drastic turn in the last 6 months. And of course, it won't get better.
These are all of your mementos. Carlene.
My friend, and we are still friends today.
Right. You just saw her about a month ago. She baked you a fabulous pound cake.
She has a lot of friends. She's touched a lot of lives, and a lot of people always, they try to reach her and stay in contact with her. They realize they can't hold long conversations, but she knows most of them. She can recall a lot from when she was younger. Most of her short-term memory is what we are noticing is causing her the most difficulty.
She's still trying to be the head of the household. That's one thing I also find interesting. Her maternal instinct is still intact.
I watched my father go through this, and I'm watching it again, and there's nothing I can do.
This is someone who needs assistance with bathing, with dressing, can't cook for themselves, so they need someone to prepare meals for them.
Carlton Garner works as a contract manager for Hennepin County Human Services. He helps coordinate adult daycare services for all of Hennepin County. Despite Carlton's inside knowledge of the system, it was still hard for the Garner family to find daycare services for Marie.
They had to come in and do like mental tests, and then they had to come in and do physical tests.
That was in July of last year. We did not get connected to services until January of this year.
I think my most difficult piece has been finding places that would be geared toward African American clients. There just aren't many things in Minnesota.
Well, hello.
Yep. Good morning.
Good morning. How are you this morning?
I'm
excellent.
She goes to an adult daycare that she's kind of the life of the place, and they look forward to seeing her, and a lot of the people can't get around as well as she does, and she loves to help other people.
It would put a smile on your face. That's the truth.
It's a diverse group, and she's able to blend in there. Now, if she had to go into a facility, then it would be even harder.
Hey, Lily. We brought some poets to meet you.
I know my mother growing up in the South at the time that she did, she's gonna work better in an environment that are gonna have people that look like her or have similar interests that she had.
Have a happy day.
Thank you.
If I can just keep her smiling and happy, trying to find the proper resources to cater specifically to her. You just have to keep pushing and keep trying until you can find one that kind of gets close to where you think she would be comfortable.
You enjoy coming here, don't you? You have lots of friends.
Yeah.
Call sooner if things change, okay, or your symptoms worsen. Just let us know.
Every single one of us is different. Every single one of us comes from our specific cultural background in terms of what we believe, what we hope for, and so we have to really seek to understand their perspective. The important thing is self-reflection. What is my biomedical culture? How do I behave with people from other cultures? And then to try to first listen to patients and to learn more about them. So approaching interactions with patients with humility and the assumption that we have a lot to learn in order to be better care providers for patients.
I'll give you some insulin today.
Okay.
Then I want you to bring your meds in. I want to see you Friday morning.
Okay.
At 8 o'clock. One of the things that is developed over years is a passion to actually make people better. And in my world, I don't just make them better. I actually like to make a difference in their life. And they come in and give you something that's far more valuable than money.
Give me a hug. Let me give you a good kiss before you go.
Those general, basic human principles about kindness and compassion and empathy and being a good listener, those are things that we are teaching in medical school now and that we expect of young physicians. And if you are that kind of a person, you are much more effective as a healthcare provider.
Okay, all right, we'll do it. All right, thank you very much.
Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Life Course project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.